I'm Melinda Fontaine. I'm here at Walnut Creek, and I want to talk about some tips for how to take care of yourself and have the best possible recovery after a radical prostatectomy. So first things first, you just had a prostate removed. Let's take a look at where the prostate is and how it functions. So here is a model of the pelvis. All this white area is a ring of bones, stabilizes you. All of the pink stuff we're looking at underneath the pelvis or inside the pelvis, if I move the bladder out of the way, are your pelvic floor muscles. This is the bladder, this is the prostate, and here's the urethra. So when you take the prostate out, you lose some stability underneath the bladder where the urethra is, which is very important because that's how we tell the urethra to close so we're not dripping urine all over the place, right? So if we're trying to think about how to prevent and or avoid and improve urinary incontinence, we're going to think about the stability in this area. So underneath where the prostate was are your pelvic floor muscles. They come in like my hand here. Typically before surgery, they're doing fine, and I would call them all average, and they're great. After surgery, you need extra muscle. We need to improve the strength, we need to improve the endurance, we need to make sure you're using all of the muscles and all of the muscles appropriately and at the right time. So to do so, we're going to focus on squeezing the pelvic floor muscles in the front of the body around the urethra. So these aren't the muscles that you use when you pretend or actually stop the flow of urine. But the best way to really get those muscles contracting is to think about pulling the scrotum and the penis up and into your body. When these muscles contract, they're going to squeeze and close off around the urethra, and they're also going to lift up into your body because the shape of the muscles is like a basket. So in addition to practicing strengthening your pelvic floor muscles, you actually also really want to pay close attention to your core muscles, which is your abdominal muscles, your back muscles, your side muscles, some of your glutes can be involved. But really, let's think about the abdominal wall for right now. So these are not your sit-up muscles. What happens during a laparoscopic surgery is actually those sit-up muscles run up and down from the bottom of your rib cage down to the top of your pubic bone can actually separate from each other. Sometimes after surgery, it just goes right back to where it started from and it's never an issue again. And sometimes it does not, and you actually have to work on it to make sure that it closes up nicely. Now, the reason why this is so important after a prostatectomy is because one of the big side effects people experience is stress urinary incontinence. And if you have a weak abdominal wall, you're more likely to have stress urinary incontinence. So if you think about the abdominal wall, it comes and it attaches to the top of the pubic bone, which is attached to the pelvis. And all the fascia that continues from the abdominal wall continues down into the pelvic area. If you have a weakness in your abdominal wall, especially right in the middle, it's going to be very hard for the pelvic floor muscles to create excellent closure around the urethra. The third tip is you have to remember to breathe. So breathing correctly and using your diaphragm when you breathe is actually going to help your pelvic floor muscles to be stronger and to have good range of motion. And it's going to improve your coordination and your ability to use these muscles. So if we think about the diaphragm, it's a mostly horizontal muscle underneath your rib cage. And your pelvic floor is a mostly horizontal muscle in your pelvis. So the two of them move together and they maintain the pressure inside your abdomen. If they're not working together nicely, you're going to increase the pressure in your abdomen, increasing the stress on your pelvic floor, leading to more leaks, especially if your pelvic floor happens to be your weakest link right now. So if we think about it, when you take a big breath in, your diaphragm goes down towards your toes. It also makes your belly inflate like a balloon. You can also notice the bottom ribs expanding in 360 degrees around you. At the same time that you're taking this big, huge breath with your diaphragm, your pelvic floor is also dropping down towards your toes a little bit. And so you're going to feel the pelvic floor being longer, softer, lower, and more open. And this is a state to practice relaxing that pelvic floor if you want to get the most possible range of motion that you can. And then when you exhale, your diaphragm's lifting up, your pelvic floor muscles are lifting up, which is just going to create a gentle upward motion and slight closure. You can emphasize that by doing a Kegel at the same time. Another thing important after surgery is blood flow. If you think about it, the blood carries the oxygen and the nutrients and everything that the cells need to repair the tissues that it's working on. Also, the nerves. Nerves love oxygen. So the two nerves everybody talks about after prostatectomy are the ones responsible for erectile function. In a lot of surgeries, your surgeon will share with you that they were able to spare, means they did not injure these nerves, but now we want to make sure they have tons of oxygen post-surgery. One of the best ways is to have an erection, but erections are hard after surgery. So if you can have an erection, have erections often. Excellent way to get blood flow to the area. Practicing pelvic floor muscle exercises is one way to increase erections. Another popular tool is vibration. So vibrations can actually increase the muscle contraction that you're doing and can bring blood flow back to the area. And let's take advantage of all the things that your doctor can offer you as well. So if your doctor has offered you a phosphodiesterase inhibitor such as sildenafil, take it with the attempt to have an erection, and you may or may not, but you're going to increase blood flow because these medications are expanding the blood vessels in that area. I've also seen injectable vasodilators prescribed, which also do a really, really good job of getting blood flow to this area and helping those nerves recover nicely. And lastly, you can also get a vacuum device if you haven't already been recommended one. All this does is it uses negative pressure to bring blood flow into the area as well. And you can use that in combination with your medications and in combination with doing your Kegel exercises. Lastly, I want to touch on a subject that healing from surgery is not just a physical process. There's a lot of emotional and mental hurdles that you also have to go through. So one of them I want to talk about is sex may look different after a surgery. Maybe it doesn't, and that's great, but for a lot of people it does. Ejaculation doesn't happen, orgasms can be different, erections can be different, but I want to encourage you just to take the time to continue to participate in sexual activity. So solo sex is a great way to explore what does and does not feel good to you right now, what's the same and what's different. And it's also a great way to increase blood flow to the area. And partnered sex is also a good way to maintain a relationship. That doesn't have to look the same as before surgery either. This could be just maintaining your physical and emotional intimacy, however works for you and your partner. In addition, this could be a good time to expand our definition of what sex means. So it'd be a great time to try new things or revisit old favorites, to think about things instead of trying to recreate experiences you've had just the way they were before surgery. Just focus on maybe setting an intention for having the most pleasure that you possibly can, however that looks right now. So to wrap it up, we talked about pelvic floor muscle strength, we talked about core muscle strength, we talked about breathing, we talked about having erections, and we talked about keeping pleasure and intimacy in your life.